This is Dr. Tiwari.
And this is Dr. Kocak.
And you're listening to the
Best Podcast Ever.
Broadcasting from Columbus, Ohio, we'll be talking about plastic surgery procedures focusing on only the breast.
Ranging from breast reconstruction to breast enhancement and reduction, we'll cover everything you ever wanted to know about the breast. Welcome back to the Best Podcast Ever. We're really glad you were able to join us today. We've actually decided to talk a little bit about flat closure breast reconstruction. It's a topic that isn't discussed that much, and you won't find a lot about it if you try to read about it. So we felt that this is something that we do quite a bit, and we thought it might be a great topic to cover here in one of our early podcasts. So, we're going to kind of just jump right into it today, and we're going to go ahead and start talking about what is a flat reconstruction. What is a flat closure reconstruction, Dr. Tiwari?
So what is a flat closure? It's something that I think has never really been defined for people. I think at its most basic, it's a reconstruction without implants, a reconstruction without any tissue. And it's getting to a nice, even, proportional closure without a lot of hanging tissue. That's probably the easiest way to think about a flat closure. So that, patients can go on, they can wear clothes, not have a lot of overhanging, not so nice looking excess tissue without a lot of areas that are kind of, what's the word I'm looking for here, Dr. Kocak?
Asymmetrical or redundant. Yeah, those types of things, anything like that. Yeah, and I think it's important that we clarify that, this flat closure breast reconstruction is something that is something we would discuss in someone who's having a mastectomy. It's not something that comes up in any other context. It's someone who's either having a mastectomy or has had a mastectomy. And I think when we talk about, who's a candidate for this type of thing, we have to, I think, be very clear and be able to say that, these are patients who are going on and having a mastectomy for either cancer or sometimes for just genetic high-risk situations. And they may, at that time, elect to have no type of breast reconstruction done whatsoever. And just not doing a reconstruction sometimes is a tough thing. It doesn't always settle out as a nice, even, smooth contour on the chest wall. And we have to employ several techniques, several plastic surgery techniques to be able to get the areas to close smoothly and comfortably so that the patients still have good range of motion of their extremities, but also that they don't have a bunch of redundant tissue on the chest wall that might cause them trouble in their clothing and may look unfavorable through their clothing.
I had trouble defining it. It's because, and I think it's patients have trouble defining it. I think people know what they want, but we haven't really even developed like the language in plastic surgery to help people understand what they're looking for. So I think the way Dr. Kocak said it was perfect. And it's something that's difficult for patients to wrap their heads around because it's not really something that's talked about, with their breast surgeons or their plastic surgeons.
And I think it's important to kind of delineate how it's different from just no reconstruction. I think there are some cases where a patient could have a mastectomy and have no reconstruction and be closed with a flat closure basic technique, and that will give them a flat closure, and they may not need anything else. But I think in most cases, you have to start to do other things and be planning ahead or designing the mastectomy in particular ways or doing things that we'll talk about here in a bit. But that makes it different from just no reconstruction. It's actually a flat closure reconstruction. So it's something that I think we're really trying to educate patients and even ourselves at this point that there may need to be more done than just no reconstruction. Rather, we have to do things to make that flat closure reconstruction something the patient will, be able to live with for the rest of their lives.
There's a lot of terms that get thrown around, things like Goldilocks closure, the swim closure. They're all variations of the same theme, which is to try to get as much tissue at the chest as the patient wants. So sometimes that's a completely flat closure. Sometimes it's actually leaving a small breast mound. And I think those are all parts of what is considered a flat closure. But I think at its very essence, it's understanding that we're not talking about implants. We're not talking about a DIEP flap or an S-gap or a DUG flap or one of those other types of flap reconstructions.
Really, all the operations that kind of go into this are local. They're in the area of the chest. They don't really require tissue from other places unless we start talking about fat grafting and doing some things to smooth out the contour. And that, in that setting, we would be borrowing fat from other places, but not like a flap, not a big microsurgery operation. It's a smaller procedure. What's a typical flat closure procedure look like?
Probably our average patient is somebody that's already had a mastectomy and is coming to our office because they want to be flat. And what that will mean is in the operating room, where they go home the same day as an outpatient surgery, we will elevate the tissue, make the scar maybe a little bit longer, but in making the scar longer, reduce a lot of that excess redundant tissue. A lot of the time, there's no drain. And again, these are people who do not necessarily have an implant, but have had a prior mastectomy. And so in that setting, we probably would not use a drain. If we're taking out an implant, doing a total en bloc capsulectomy, then we would use a drain. And most people will go home that same day. We'll oftentimes have a nerve block done, so they're not taking any narcotic pain medicine. We don't need antibiotics for them to go home with. They'll get some antibiotics right before the operation. So in comparison to some of the other reconstructions, it is a lot less surgery. But I think it still has its own, particular parts to it that make it difficult. But for the patient, as far as recovery, I think a week-long recovery is pretty reasonable. Maybe about a month before you're getting back to exercise, like treadmill, Pilates, weight training. But really about a week till you get back to your normal strength and energy pattern. What do you think about that, Dr. Kocak? Is that a fair summary?
Oh, yeah, for sure. And I think that summarizes pretty nicely the average procedure. I've
got a question for you.
Oh.
What if somebody has had radiation? How does that affect all this?
Definitely, yeah. So this is where we start to, talk about some of the other techniques we might have to recruit or borrow in the process of getting a good flat closure. So obviously radiation can cause skin to have some trouble healing. It can also cause fibrosis or scarring to form in the tissue itself. So it's not as flexible, it's not as pliable, it can have trouble healing. And so those are some of the things we're going to have to battle when we're trying to get a flat closure on that radiated side as compared to a side that's not radiated. And I think probably the most effective thing in that setting is going to be, first and foremost, getting a closure as flat as possible, getting the area to heal, but potentially employing things like fat grafting, because fat would be taken from another part of the body that wasn't irradiated, and then you take that fat and you inject tiny micro droplets into the skin and subcutaneous tissue. And those are nice pieces of tissue because they're not irradiated, and they can actually have a very positive effect on the tissue where the radiation had been done. They can cause the tissue fibrosis to improve a little bit, and they can also facilitate the wound healing, and they can thicken the area a little bit and potentially make the contour a little better. So I think that's probably one of the most effective techniques that we might use in a flat closure that has been previously irradiated.
What do you think about doing this in a one and done type surgery? A lot of patients, they very, very understandably don't want to go through a whole bunch of procedures. And, when I hear fat grafting and drains and all these types of things, it just seems like a lot.
And it might be, but it depends on the case. It depends on the patient. I'd say in most cases, we do get one and done. But I do think certain factors might make it more likely to be a staged process with more than one surgery. And the good news always is if there's more surgeries, the subsequent operations are always smaller operations. They require less time in the operating room and shorter recoveries. But I think things that we might start thinking about some staged procedures being necessary are going to be patients who, like you just said, had previous radiation. I'd say patients who are higher BMI, because there's going to be tissue along the chest wall area.
What's BMI?
Body mass index. So anyone who's heavier, weight, has more subcutaneous tissue, more adipose or fat tissue in the chest area. That's stuff that we're going to have to try to get as contoured smoothly as possible. And we may not be able to get everything in one setting. And if after we do an operation, if things settle unfavorably, that's a reason to come back and try to get those areas to be as smooth as possible and as flat as possible. I think also patients who might be actively smoking might have a harder time healing areas, might be at higher risk for things like seromas, fluid collections. So those might be reasons that we'd have to come back and do subsequent staged operations. But I'd say for the most part, this is a one and done operation, wouldn't you?
Yeah, I think it is. Another big one that always comes up is insurance going to pay for this?
Yeah, I think that's a big question, right? I think the answer is they should, because it is certainly a reconstructive operation. It's a part of the breast cancer reconstruction process. And I think as people become more aware of this option, and I think as there's a wider acceptance that a flat closure reconstruction is a reasonable reconstructive option, I think then we'll probably see a little bit more sort of easing up in terms of getting through the insurance process. But at least in our practice, which is very much geared towards breast reconstructive procedures, I think we've seen it go through the insurance process okay in most cases.
All right. That's what we have on flat closure. So if anybody has any questions, please always email us at info@mwbreast.com. Hope to talk to you all soon.
Thanks. Have a great one.
Thanks for listening.
We hope you found this episode helpful.
Want more info? Connect with us at mwbreast.com.
And go behind the scenes with us on Instagram at mwbreast. Thanks for tuning in.
And join us next week.